This is Bolibana village, Upper River region, home to nearly 200 inhabitants in a far-flung community more than 20 miles from Fatoto. The borderline community can be reached by driving long stretches of unpaved roads. For a community like Bolibana, health services are difficult to reach, with more than 50% of the inhabitants living below the poverty line. This is the community's only health facility, serving nearly 8 communities, 3 of them from eastern Senegal. It's midday in this part of the country, and also the community's clinic day.
A lot of people come from different villages. We see people from 7 villages, including Bolibana. So Bolibana within this area is the key village, and you have other satellite villages, which include 3 villages from Senegal. They also do come here, and they are being captured in our RCS services.
Lines of patients await the arrival of the monthly mobile clinic, which often runs late into the afternoon.
It is conducted once in every month, that is every first Thursday of every month. As you know, today is the first Thursday of the month, so by the time we leave here in the afternoon, we will come here sometime in April, the first Thursday of April. That is how the service has been done.
The borderline community remains largely cut off from the rest of the country in an area largely underdeveloped. Here, the regional health team only targets people in dire need of health services for common ailments such as malaria, diarrhea, and pregnant women.
We see pregnant women, and we also see children who are less than 5 years. For the pregnant woman, we monitor their pregnancy, their welfare, examine them, assess them, and give them also drugs. That will also help the pregnancy to go up to term successfully and without any complications. For children under 5, their weight is being monitored, that is their growth is being monitored. They are also being immunized, that is they are being vaccinated against the vaccine preventable diseases in this country, which includes diarrhea, pneumonia, tuberculosis, and tetanus, and lot other more diseases.
Traditional birth attendant Fatou Cisse is calling on government and partners to upgrade the community's only health facility.
If you can see the nature of the building, like it's very open, and this is a problem that is affecting the operation of the RCH. I think as far as it is a health intervention site, it needs to be ventilated. The conditions should be conducive to the mothers and the people coming for the RCH.
The main issue we have been confronted with is the structural system, like the structure where the service is being rendered. If you look at the structure itself here, it's dilapidated.
94-year-old Alhaji Mahmoud Trawale is the village alcalo. However, due to old age, we could not engage him much. His son Bala Tarawale led us to see the exact demarcation bordering Gambia and Senegal. Given the geographical disadvantage of this community, challenges in economic and social services are apparent. Imagine having access to the most basic healthcare services just once every month. Such is the case of over 200 residents of Bolibana in the Upper River region and 7 other frontier communities whose location has put them at a serious disadvantage. Is it a case of out of sight, out of mind? Samuel Bach, GRTS.